Hello everyone, this is Dr. John Makoff here. I thought I'd talk today a little bit about the physical aches and pains, the muscle aches, the muscle stiffness, I don't know, things just don't feel right in the body, muscle discomfort, and whatever. And sometimes that is muscle stuff. You know, sometimes the muscle's not moving enough, sometimes there's an imbalance in the muscles that has to be figured out. Sometimes there is an overuse of one muscle side versus the other, or, you know, in some athletes there's sports that are more one side than the other, like tennis, golf, things like that, and that can start to create an imbalance in the muscles. That causes a overstress in the body and the joints through the imbalance of movement. So there's that. Sometimes it's lack of moving, or in the posture you might be sitting, or you know, when you're overusing muscles just to hold yourself in certain positions, that can put a little excess load on the spine. Or if you have very little muscle activity, sitting, standing, whatever, you know, and you just put all the load on your ligaments and your joints and stuff, where your muscles are your primary support system around the bones. So your primary active support system. So when you aren't utilizing it, sometimes you put extra stress on your discs, on your ligaments, on your muscles, your tendons, and then when you move in a non-balanced posture or an overcompensated posture, you may be putting more stretch and irritation on the tendons and the ligaments, and so sometimes that has to be evened out. Sometimes if your eyesight is off, then you will be in different head posture to try to see better, or different head tilt, which also going to affect your breathing pattern, which is also going to affect your low back. It's also going to affect possibly your shoulders, because if you can see, when I'm sitting upright, straight, if I bring my arm to the side, I can go all the way up. If I sit with my head forward, I can only get this far without forcing. And forcing, I'll probably injure myself, which I don't want to do. So these are some ideas where some of the muscle aches and pains may come from purely mechanical, even when you're possibly walking off, meaning your gait is out of rhythm, or gait is like the pattern is not smooth, or you're utilizing the wrong aspects of the body to initiate the gait. You know, are you pushing yourself forward, or are you trying to reach for a step, you know, on a flat surface? That can change things, versus stairs, versus climbing, hiking. Different patterns for each. Running, different pattern. And that could be a little off, and that sometimes just needs an awareness change, or we need to work on some of the brain nerves to recalibrate them to fire better, and making sure they're connecting to you while you're in your gait motions. So there's those. But there's also a lot of different things that cause muscle aches and pains that aren't the muscles and aren't the joints. You know, and it's hard for people sometimes because we're in a very visual, tactile society. If we can't see it or feel it, we don't always recognize that that's a possibility of where something's coming from. So I did a video the other day about inflammation, and inflammation itself can cause the muscle stiffness, can cause the muscle inhibitions, overprotections, and you know, went a lot over what may be causing inflammation, from food sensitivities to hidden infections to sugar to caffeine to emotional stuff, traumas getting triggered, to chemical sensitivities that are either inhaled, touched, ingested, injected, any of those things. Heavy metals block your nutritional absorption, so that can affect how your body processes in every single system in your body. So those are different things that can cause, and there's more, can cause inflammation. It causes the muscle stiffness and muscle aches. But there's also sometimes the sensory system of the nervous system. If we've had certain injuries in our body of, even just like that stepping off a curb and having that jolt through our hip, and then we have to walk it off a little bit until it sort of feels better. But we may have actually injured a part of that sensory system, and until it gets back online, it doesn't know how to interpret the vibration coming up through that aspect of your body. So that your bone may be impacting the joint more because it doesn't know how to interpret that vibrational sense until we retrain it. I use quantum neurology to do so. But that can go for pain sensations, especially after some surgeries or injuries. That can go through light touch, deep pressure, proprioception, which is movement ability. Form recognition is sometimes an object can leave a neurologic impression on us that inhibits us every time we have a shadow of that object, or every time we see something that can be a color, a shape, a letter, or whatever, can inhibit our whole nervous system. And so there's things that we might have to do to recorrect that so that everything gets back online and works properly, and then that can affect the inflammation, the stiffness, and the movement ability of the muscles and the joints. Sometimes it may be indicating a lack of health or lack of nervous system congruence with certain organs. If your lung has something going on with it, you might start to have shoulder problems. If your heart has something going on with it, you can have low back issues. You can have some shoulder issues from the inside of the rotator cuff. You can have some grip issues because there's neurologic contribution from the heart to the hand muscles, and that may be an indicator. And sometimes it could also be emotional issues, and so how that inhibits the muscles that those emotions are more connected to, and that can cause more irritation, more stiffness, more compensations. So just to get thinking in a broader sense, so that when something's going on, it's like, all right, what is this trying to tell me? And if I can't figure it out, let me go to someone who can help me interpret what my body's trying to say, versus assuming. Yes, if there's a trauma of someplace, it's probably where that trauma happened. But even with that, depending on the trauma, there's sometimes emotional surroundings associated with that as well. So, hope that helps a little bit. If you have any other questions around this or any comments, please leave below. If you have questions about scheduling with me in person or remote, just message me, or check me on my website and contact me through there. Hope everyone's having an amazing week, and I'll see you again. Bye.